Hello, everyone. Today we have Dr. Lokesh with us, and Dr. Lokesh is a practicing orthopedic surgeon in Qatar, having more than 2 decades of experience in this domain. And in last 6 years, he's practicing in Qatar. So I requested him today to come here on the show and give you some guidance on your orthopedic health, especially on your bone health, in a simple words. In addition to that, he has keen interest in spirituality, personal development, and he's a certified life coach. Recently, he has done certification in life coaching. And apart from that, he has so many other domains. I find less time here to define how much he has in his plate. So, welcome, Dr. Lokesh, and thank you so much for joining us today, giving us your time, precious time, and we are really grateful that you are here today.
Thank you very much. Thanks a lot for a wonderful introduction, Ruchiji. And I'm really delighted to be joining with all your viewers today. Thank you very much. It's very nice that your viewers would like to know about the bone health, and it's something very bone orthopedics is something very close to my heart actually. So the spine care particularly, these are all very close to my heart. It's my first love. So thank you very much for getting me on board. Thank you.
Thank you, Dr. Lokesh. So, I will start with my first question: how to take care of bone health?
See, there are three important things. I mean, I'll talk in very brief. Three tips which are most important are: the first thing, one needs to understand the role of your diet. Second thing is to understand your role of your physical activity. Third is your other lifestyle, which can affect your bone health. So the diet, as I said, is got very important from the aspect of your bone health. If you are not taking right diet, if you have any absorption problems, any gastrointestinal problems, it can get affected. If you are leading a sedentary lifestyle, not doing much of physical activities, you will have definitely bone weakness. And thirdly, your lifestyle problems, what kind of addictions you are having in your day-to-day life. That's very, very important as far as your bone health goes.
Doctor, we keep on hearing that in the later stages of life, there will be an issue with bone health, like your bone will not absorb calcium and other minerals which is required for the bone health. What happens there? Why this situation like come into place later on?
See, we need to understand what is the function of bone actually. The bone provides a structural support to the body. It provides a skeletal system. It provides attachments to the muscles, right? So it is basically the whole skeleton. It supports the organs of the body. It engages all around. All the muscles will be attached on that. So the bone health as such plays a very major role in your day-to-day functioning. So you will have to consider one point, like in young age, whatever the bone functioning, bone strength you have developed till 30 years of age, because by 30 years of age, one attains peak bone mass. Because there is always a constant turnover of bones. The bones is new bones forming and the old bones breaking. So this chain, this cycle will get broken up after 30 years of age. So in young age, it is very, very important to be physically very, very active, to do a lot of exercises, to do a lot of physical work,
Mm-hmm.
so that you develop a peak bone mass by the age of 30. And later on, you have to maintain your good muscle strength, do a good amount of exercises, keep yourself physically active. and you will not be facing much of problems with that.
Mhm. So it means it's very important to take care of your bone health from the very beginning. It's not that later on you will start taking care of. Even first
Ab-
initial 30 years are very important.
That's right.
And
So from
I
young
don't think
age,
so many people know about it.
yeah, it's very, very important that you have to keep yourself physically active. Your bones are constantly changing. In young age, you will have a good bone mass, but unless you keep the activities level, as you must have seen, there is last time also I have covered up some very important point. Is sitting equivalent to or worse than smoking?
Mm-hmm.
Right? If you are leading a very sedentary lifestyle, if you are sitting maximum hours of like in even in this Apple Watch also, they have come up with one indicator that how long you are standing, how many times you are standing.
Mm-hmm.
So that also is very, very important.
Yes.
If you are sitting all the time, if you are lying down most of the times, it's no good for your bone health.
Mm-hmm.
Particularly after 40 years of age, your activity level will make a very big difference to your bone strength. So it is very, very important that you are keeping yourself physically active. You have to keep doing lot of activities that will only will keep your bones stronger.
Wow.
When you are young,
Really
your bone
eye-opener.
bones faster than it breaks down the old bones.
Mm-hmm.
Most people reach their peak bone mass, as I said, by 30 years of age, but you lose slightly more bone mass after that. So now, in later on, if you think that if you want to prevent your osteoporosis, everybody is going to get osteoporosis. It is not that somebody will have it and somebody will not. But if you have worked on your bones very well, if you have strengthened your bones very well by doing a good amount of exercises, keeping yourself physically active, taking care of diet very well, and avoiding all those lifestyle factors, you will definitely can pull on very well. Maybe century you will not have any problems. You must have seen there are many people who have crossed 100 years of age even, and they have been maintaining very well. And the only secret is keeping yourself physically active.
Mm-hmm. So very
So this is
it's an
very, very
eye-opener.
important.
Yeah.
Yeah.
So Dr. Saab, you have said about osteoporosis and how can we prevent it?
Yeah. See, osteoporosis is a condition which causes the bones to become weak and brittle.
Mhm.
It becomes like potato wafers. You just make a small effort and it will crack.
Uh-huh.
The best example is tomato, the potato wafers.
Mm-hmm.
It looks hard, but actually it is not.
Uh-huh.
It will crack very easily with minimal amount of force.
Uh-huh.
So that situation which happens in older age group, and that is why it is very much required that one should keep oneself active, and
Mm-hmm.
that all depends on how much the bone mass you attain by the age of 30 years of age, because with that bone bank only you'll be keep going throughout your life.
Mm-hmm.
So that is why in schools and colleges, the youngsters should always be encouraged to do a lot of exercises, lot of activities, because they that is the time when you are developing your bone bank.
Mm-hmm.
That only will prevent your osteoporosis in future.
Okay.
All
Okay.
of a sudden, if you start becoming very active after 40, 50 years of age, that may not help that much because you do not have much in your bone bank.
Mm-hmm.
So that's the only way. From young age you have to be active, and that only activity will maintain you in long run in future, and that only will prevent your osteoporosis in older age.
Wow. And doctor, what is the role of vitamin D and other essential minerals and elements which are required? So how we can take care of either vitamin D or food? What is the
Well,
role?
let me tell you something more about it. What more important things one can do for in changing, for taking care of what affects the bone health. First thing, in as I said, in the dietary factors are there. One has to focus on consuming more and more calcium. So calcium containing foods, and calcium will get absorbed only in presence of vitamin D.
Mm-hmm.
So your question is very much pertinent. If your vitamin D levels are not good, your calcium from your diet will not get absorbed.
Mm.
At the other end, if the vitamin D levels are optimum in the body, the calcium from your diet will get absorbed very easily.
Mm-hmm.
So that is where the vitamin D has a very major role, and the deficiency of it can give rise to a lot of muscular pains, bone pains, particularly the proximal areas, thigh pains, arm pains, the back pains. So the diffuse back pain can be there. When you wake up in the morning time, and like how do we distinguish between acute lumbago, which happens normally by lifting heavy weight,
Mm-hmm.
sudden back strain comes over. To distinguish from this kind of acute lumbago situation to vitamin D deficiency kind of disorders, one thing we need to consider, normally the lumbago problem will be much more in the evening hours.
Mm-hmm.
Active time is already gone, and most of the times the pain will be happening in the evening hours. But vitamin D deficiency problem more will be diffuse, and when a person wants to wake up in the morning, finds very difficult to come out of the bed.
Mm-hmm.
So these are the smaller tips to understand that one may have these kind of muscular pains, bony pains because of vitamin D deficiency.
Mm-hmm.
Another important thing is to take care of your bone health is one more tip is important, that physical activity, if you are physically inactive, it has a very high risk for having osteoporosis. And another thing was, as I said, the lifestyle factors, which are the substance abuse, tobacco in any form,
Mm-hmm.
whether smoking or chewing, in any form. Tobacco is worst for the bones.
Mm-hmm.
So the bone quality will tremendously, very rapidly start deteriorating. Those who are not able to give up for smoking, they are going to develop osteoporosis very fast. So this is very important to be understood. As such, in alcohol drinking wise, for ladies, as ladies are more prone for osteoporosis, there is genetic disposition, gender disposition too. Ladies are more prone to develop osteoporosis as compared to gents. So ladies are not supposed to take more than one peg in any 24 hours. At no cost, one should exceed more than one peg for ladies and not more than two for gents. And as such, avoid any kind of substance abuse, maybe alcohol, maybe smoking. Strictly no.
Mm-hmm. Mm-hmm.
So that's very, very important.
Mm-hmm.
As you will age, your bone turnover is going to get affected, and everybody is going to have osteoporosis at some point of time. More prone after 60 years of age, but ladies in postmenopausal age group, they are more likely to have it because of the estrogen deficiency. They are going to be more prone to become osteoporotic. Then hormonal levels. Too much of thyroid hormones can also make it prone to develop bone losses, more prone to develop osteoporosis. Then the people who are eating disorders are also some of the very important things, which are like those who are not eating well. Many times they do such unbalanced dieting. They don't, young girls, they don't eat well. So if they have developed a kind of aversion for eating, what we call anorexia nervosa or bulimia, all these are eating disorders, and many other like Crohn's disease, celiac disease, Cushing's disease. These are all the problems where, in spite of eating, they may have malabsorption problems and they may develop weakness of their bones, or they are more prone to develop osteoporosis. Then there are certain medications. The medications are also making one prone to develop osteoporosis. Those are medications are corticosteroids, prednisolone, cortisone. So these medications, dexamethasone is also damaging bone health. So these are all very important things one needs to understand. Epileptic patients also must be aware of the fact that they what medications, anti-epileptic medications, they'll be started on. Most of the times their physicians will brief them, but they have to be aware of the fact that all anti-epileptics, by and large, will reduce their bone masses. So they have to keep themselves more active physically, and they must consume, not only take regularly vitamin D, they must be taking calcium containing foods and calcium supplements too.
Mhm. So these are some very good, information. I don't think so. Most of the people they know this. So
That,
how would a person know that which medication are kind of causing osteoporosis or their after effects are, like it will have this impact on their bones? How would they
yeah.
know? Is there any way they can know before consuming any medication?
Most of the times we do while giving our consultations, all the doctors will be telling most of the measure of the side effects. But yes, these are the effects which will be happening in the long run,
Mhm.
because corticosteroids and all these are medications which are required only when there are no other alternative options left.
Mhm.
So, like asthmatic, chronic asthmatic patients, chronic epileptic patients, these are all people who will be on such medications for a long time.
Mhm.
So they should be aware about all these, and it is a standard advice. And everybody nowadays, everybody is internet savvy, and everybody can access net.
Mhm.
People do go through all Google and all.
Yes.
But the most important thing is, most of the times doctors will also be telling it. But one should develop regular habit of knowing the effects of the medications.
Yes.
If they get into doubts, they can definitely consult with second, third consultation. They can ask their doctors
Yes.
how I can prevent all these things. And as I said, all these medications which will be hampering the new bone formation, these are all steroid medications, anti-seizure medications, phenytoin, phenobarbital, and most important, the medication what we use for acidity, proton pump inhibitors.
Mhm.
These are the medications which are very prone to develop bone weakness and affect the land up developing early osteoporosis.
Mm. Because normally people think this is just acidity medication and they just take it sometimes, even not even in consultation with the physician. They just take it that last time doctor has given me this and now it is in my home storage. I have acidity, let me take it. But acidity medication can be dangerous to your health.
That's right. That's right. Absolutely true. Very well said. No medications. It's very strongly recommended. Unless the medication is over the counter available medication, don't take it.
Yes.
No medication should be taken without consulting a doctor, without a prescription.
Yes.
Many times we do have many medications lying in the past, but past medications were advised to you based on your past problems.
Yes. Exactly.
Now the problem what you have, there might be different reasons, different medications you might be requiring. Don't take it on your own.
Yeah.
This is very, very important for all of us to understand that any of these medications, unless you are prescribed, and all these medications are prescribed for a very particular duration.
Yes. Yes.
Of course, it will not happen in the very short term, 2 or 3 days time. Many times when we do self medication, we do it for a couple of days time. And if there is not much of improvement, we do consult a doctor.
Yes. Very well
So
said.
in 2 3 days time, it is not going to make much of difference. But proton pump inhibitors like this pantoprazole and esomeprazole and
Yes.
all these kind of medications, um, they will definitely have effect in long run. They will have effect on bone turnovers and
Yeah.
osteoporosis. They make the bones weaker. But yes, otherwise also it is not recommended to be taken more than 4 weeks time in one go. It should not be taken for a long time.
Yeah.
There should be alternative investigations done, maybe endoscopy, or find out the reason why one is having acidity problems. No, it needs a consultation with a gastroenterologist instead of continuing to take proton pump inhibitors and medications like that.
If the levels are up in the body, what should someone do? Obviously, immediately stop taking vitamin D and calcium, but how much
Yeah.
time it takes to come back to normal and what then they should be taking care of?
So there has to be some reason. One has to find out constantly if there is a excessive calcium in the body. See, the normal requirement of anybody, any adult person up to 70 years of age is 1,000 milligrams consumption a day is required. In ladies or pregnant ladies, it is 1200 milligrams per day, the daily allowances there. So good source of calcium is required, and we do get it by taking almonds, by taking broccoli, and all these are soya products. So coming to the vitamin D, the daily allowances and all, one has to understand the daily allowances for adults, it is around 600 international units. And the recommendation, the requirements are increasing with age. After 50 years of age, there are very less likely chances that one can get formation, synthesis of vitamin D by sunlight exposure. It is not very common to observe that. So one has to take vitamin D supplements at least 2 to 3 months in a year. Take it once a week for 2 months' time, and after that, once in a month, at least 50 or 60,000 international units, vitamin D should be taken. There is no rule of taking for active, physically active person. There is no rule of taking calcium.
Great. Thank you, doctor. And my next question is, then, as you said, vitamin D is very essential to calcium absorption. How people can take care of their vitamin D level? But you said, like you touched based on that they can
Yeah.
take weekly medicine. Apart from medicine, what else they can do?
I think we should not call it as medicine. We should call it supplements.
Supplements, yeah, I think that's the right word.
Medicine affects the psychology very differently.
I know you are right.
As it doesn't, it is basically called a sunlight vitamin, but to sunlight exposure, it has been observed that it doesn't works out much. People in the morning hours when they are roaming around, they think that vitamin D must be forming. It actually doesn't happen so. There's a fantastic scientific article about it in India, at least by 11 o'clock, 11 to 2, when you are moving around and exposed for more than 20% of your body surface area, then only the vitamin D will be synthesized. If you are walking and exposed for more than 20 minutes, then only vitamin D will be adequately synthesized, and that also should be a regular daily habit.
Okay. Okay.
Yeah.
And what about food?
Yeah, food for vitamin D, one should be taking mushrooms, one should be taking eggs. Eggs, yellow. The yellow part of egg is very important. Vitamin D is there in the yellow part and it is not there in the white part.
And most of the people don't eat yellow, they eat white.
Exactly, exactly. That's what I want to bring this point. Yellow people are throwing it out. Egg as a whole has to be eaten. Don't make this mistake of throwing out yellow. People are throwing out yellow thinking that this will disturb their cholesterols. Don't worry about it. It will increase your HDL levels, good cholesterol, and it will reduce your LDL levels. So this is a myth about eggs. I strongly recommend through your platform that people who are taking eggs or those who are confused about taking or not taking eggs, eggs is a fantastic food. It's a perfect food. But whole egg has to be taken. That one should remember. Don't throw your eggs out,
Yeah,
yellow
that's
part
a
out.
very important tip, what you have said. And Dr. Lokesh,
Mushroom,
I
eggs, fortified foods. Most of the time, what
45
we
food.
have, all the dairy products are all fortified foods. So that has to be taken regularly.
And I also would like to tell the viewers that Dr. Lokesh has beautiful YouTube channel, Lok Talks. And there, Dr. Lokesh has made full-length video on vitamin D and other various topics. So if you want to know more
That's right.
about vitamin D, you can
For
go to
your
his
viewers,
channel and
thank you
look
very much.
for the videos. Yeah.
Thanks a lot. On vitamin D, I have made 2 episodes. One can definitely go through it. And the more importantly, other than the bone health, the objective of making those importance of vitamin D was in this particular corona times, it helps in building up, boosting up your innate immunity of our body. So vitamin D has very major roles in boosting your body immunity. So through this platform, I would again bring up this point that we need to boost up our body immunity. and for that vitamin D is must. Take weekly vitamin D, take daily vitamin C.
Yes.
1000 milligrams vitamin C should be taken, or at least take most of the foods, whatever are containing vitamin C, should be taken regularly based on regular basis. And if you want any of the foods what are having vitamin C, that is also very, very important to understand. And those are the routine diet, whatever we are consuming. All those things are having vitamin C. Is not very, most of the people do know about it. The citrus fruits and all these things are having
Yeah. Wow.
vitamin C to a very good level.
Yeah.
Most important point what I want to bring about is the physical activity. Weight bearing exercises, walking and standing. Standing, as you mentioned about my Lok Talks channel, I have come up with one episode on sitting is dangerous. It has been equivalent to smoking, and that, as we are mentioning, minimum required for our body is to stand for 3 hours
In a
in
day.
24 hours. We are
Mm.
not standing much, either we are sitting or lying down.
Yes.
So avoid sitting for long hours, long periods. It is no good at all.
Very important it is.
It will disturb your bone metabolism. So avoid sitting for very long time. So weight bearing exercises, walking, jogging, climbing stairs.
Mm-hmm.
In Qatar, I stay on 8th floor. On 8th floor, from 0 level to 8th level, I prefer to climb stairs rather than going by lift, unless I'm carrying some heavy
Great.
luggages carrying inside.
Mm-hmm.
I prefer to walk down on stairs. It's always, it will always help your body.
These are
So
some of the
avoid going
very
in the lift.
fantastic tips, Dr. Lokesh, what you have said. And I would like to just kind of debrief little bit, highlighted points, importance of exercise, physical exercise. And I think viewers would to know that these are so important. Second,
Yeah,
taking care of your bone health early in the years until 30 years of age,
that's right.
and having supplements, vitamin D supplements, taking care of,
That's
plus eating food like whole egg, for example.
yeah.
So, any last tip you want to say?
See, the challenge we face is with the vegan people.
Yes.
Vegans will not be taking dairy products. They will not be taking milk and related foods and all. They are really challenging situations, and they will not be taking even eggs.
Yeah.
So, vegan diet, I recommend that should not be taken for more than 3, maximum 6 months.
Ah, okay. Okay.
With dairy products, milk and eggs, they do have a very great role in our day-to-day diet.
Hmm.
One should not be avoiding taking it completely. The good source of calciums are there in milk, cheese,